Dear students, today I will discuss about the humerus. Morphologically, humerus is a long bone and it is situated in the arm. This is humerus. As like any other long bone, humerus has two ends and a shaft. The ends are one upper end, one lower end and a shaft. The upper end has a rounded head, this is the head, and an anatomical neck, encircling the head one lesser tubercle and one greater tubercle and a surgical neck. The rounded head articulates with the glenoid cavity of scapula to form the shoulder joint. The lesser tubercle is faced anteriorly and the greater tubercle is faced anterolaterally. The two tubercles are separated by a narrow sulcus known as intertubercular sulcus. The junctional area of upper end and shaft is known as the surgical neck. The lower end. The lower end of humerus has some articular area and some non-articular area. The articular area is divided in capitulum, rounded capitulum, and a pulley-shaped trochlea. The capitulum remains laterally and articulates with radius. The trochlea remains medially and which articulates with ulna. Besides the articular area, the lower end also has medial epicondyle, lateral epicondyle, radial fossa, coronoid fossa and olecranon fossa. Epicondyles are small bony elevations situated on the medial and lateral aspect of lower end. Respectively, these are known as medial epicondyle and lateral epicondyle. The shaft. The shaft of humerus is rounded in upper part and triangular in the lower half. The shaft has three borders and three surfaces. The borders are anterior border, medial border and lateral border. Surfaces are anteromedial surface, anterolateral surface and the posterior surface. On the anterolateral surface, just above the midpoint, on the anterolateral surface, there is a V-shaped rough area. This is known as deltoid tuberosity. The deltoid muscle remains attached here, so the name came deltoid tuberosity. On the posterior surface, in the middle 1/3, there is a shallow groove known as radial groove. The radial nerve and the brachial artery passes through this groove, so this is known as radial groove. Now, how to determine the side of humerus? The head is located superiorly and faced medially. The lesser tubercle is faced anteriorly and the greater tubercle faced anterolaterally. The capitulum remains laterally and the trochlea remains medially. Radial fossa and coronoid fossa remains anteriorly and the olecranon fossa remains posteriorly. Accordingly, this is a humerus of left side. Thank you.